Wow, and welcome to New Year, New You. I'm ready to kick it off, aren't you?
I am very excited about this whole concept.
This is Dr. Tim Treanor. A lot of you know him. And we this morning, he has been a chiropractor in our community for quite some time. But now, the name of your business is Horizon Medical, because you have a lot of good new things on the horizon, wouldn't you say?
Yes, I love that. And that's the whole reason we picked that name, the Horizon Medical.
Yes, I asked him to be a part of this because chiropractics, I've always thought, was a great part of your overall health, just to keep in shape, to keep adjusted and everything moving correctly. So, but a new thing you're doing, which I am certainly not going to talk about, I'm going to let Dr. Treanor talk about that. So anyway, listen up. As I said earlier this morning, you definitely want to hear this new thing that Dr. Treanor's got going on.
Well, Ms. Sandra, thank you so much for having me on the show. First off, I'm going to scooch up here and get a little bit more squared up so I can see everybody.
Yes.
Hey, good morning. You're looking good. Now, the whole point, and like you said, the reason we made the transition, I've been a chiropractor in this town coming on 27 years now. And part of the chiropractic model is that we need to interact with medical because we have patients that need medical. Okay, and medical has patients that need us, and so what we would do is we'd refer out to each other and such, and sometimes those patients would just get lost. It's been my dream, matter of fact, Dr. Graber and I's dream, ever since school. I mean, we're talking 30 years ago we met. Today.
Oh, really? Yes. I didn't know that.
30 years ago we met.
Oh, wow, I'm learning
today.
something.
January 4th, 1994. We both arrived in school at Western States University for chiropractic school, and we have both, and independently and together, thought chiropractic and medical need to get together. They need to work together. And so now with this concept of Horizon Medical, we are working together with a very specific goal in mind, with a very specific identity. We're not a family practice, not one bit. We're not going to come in and help your colds and things like that. We are focused on doing regenerative medicines for the joints of the body, for the things that are really aching you and closing your doors of life. And what I mean by doors of life, you used to play tennis. You don't play tennis anymore because the knees hurt too much. You used to be able to get on the floor with the grandkids. You can't do that anymore because your ankles and your hips and everything hurts too much. You see what I'm saying? Those doors of life, the things that you used to love to do. You used to like to go snow skiing, water skiing. You used to like to go hiking with your sweetheart. You can't do it anymore because of degenerative changes in your body.
Well, Tim, we should be be able to have a quality of life.
That's the point.
Yeah.
You just nailed it right there. It is about quality of life.
Yeah.
See, living, there's one thing of being alive, and there's another one of living. And living is enjoying all the options available to you, not just available to you because of your health or whatever, but because that should be available to you. The things you should enjoy. You're getting up in years. Some of us are getting up in years. I don't feel like it.
Speak for yourself.
There you go. There you go. Well, I don't feel like I'm getting up in life, Sandra, simply because I'm doing the things that I'm trying to teach people to do.
Right.
I've done the regen in my knee, and my knee has come back strong. It's come back with cartilage, and it's come back with meniscus. I have done the metabolic reboot that we do at the office, and my weight has come off of me, and my energy levels are way up. So now I promised her I'd tell you the why we went, or what the metamorphosis was between chiropractic and then medical. One of the big reasons is that we cannot reach as chiropractors as many of you as medical can. And so when we made that decision, some people are looking at me like, well, Dr. Treanor's not going to be your name on the wall anymore. And I said, I really don't care. If I can reach more people and help more people, that is the most important thing. If we can help more people open those doors of life, that is the most important thing. And it's fascinating. We went through this process of coming up with a name. And I tried several names. We actually sat down with people. Oh, it was hilarious. Sat down with people, and I'd have a list of names. And I'd look at them, and I'd go, RMT Medical. And they go, what's RMT? I go, oh, that doesn't work.
Right.
Nash Medical. And they go, well, until recently, Nash wasn't a great name around here. Okay. Coastal Medical. What is this? You having psychological issues? Is that what you're treating? Okay, so those three were out. And so I tried Sunset Medical, and they're like, is this an aging center? I tried Sunrise, and I go, oh, okay, is this assisted living now? And I'm like, okay, this doesn't work. Well, Dr. Graber and I were sitting there one day, and we're discussing these things, and a song came on. It's called Horizon by Nickelback. And all of a sudden she stopped. She goes, Horizon. And I go, Horizon what? She goes, Horizon Medical.
Yes.
And we tested that on 35 people. And they all went like this. Yeah.
Kind of resonated, huh?
Yeah. And so it to me, it's hope. That's what it stands for.
Yes.
It's hope.
Hope.
It's the thought of there's something out there that can help me. And I can help myself.
Well, there's so many people out there that I hear right now, knee. Everything is knees now and hips. And I'm hearing, and I heard from two elderly people that it's terrible. They can't have, the doctor told them they're just past the age that they can have knee surgery. So they have to live with it.
Yeah.
They said, we can't have surgery. So what can you do for somebody that can't have surgery?
Well, that's exactly why we're here. We, A, want to stop surgeries that aren't warranted.
Right.
And B, help those that can't have surgery to receive a care and a therapy that will and has the great probability of actually helping them regain their status or their ability to do what they used to do. See, that's what regenerative therapy is all about. It's called HCTP, Human Cellular Tissue Product. And that product is gathered and prepared together, and I'm going to go ahead and tell you what we receive is it is very clean, very ethical. Okay, It is taken from a uterus that comes from a live birth, live mom, live baby. Everybody's happy, cesarean section, so that the uterus comes out intact, and then that the tissue that's necessary to gather these types of cells that are helpful to us, that then they can that can be gathered up and processed. Then the process is that understand that there's no DNA of mom in there, there's no DNA of baby in there, and when it goes into you, it becomes you. And it's a signaling cell. What it does, it actually requires your body to create the healing product in you. And we don't inject this product that your body makes. Your body makes it itself, but it goes to the center where we put it. It calls it to that place. That's why we use ultrasound guided injections. That's why Nurse Linda Prezioso, nurse practitioner in this town for 100 years, 30 years. That's why she has gone to the university and learned how to inject under ultrasound guidance, so that we have a 98% chance of getting it exactly where it belongs.
So you inject this into the knee.
Yes, I've had it actually done myself. I was a little skeptical about how this really works. And I can tell you quite honestly that my knee has not been this way since before an accident I had in 2017.
Right.
And now it is functioning without pain, and it's functioning properly again. I'm able to run, I'm able to ride my bicycle, I'm able to play tennis, I'm able to do these things that the doors had closed on, you see? And so we actually take this product, and Nurse Preziosa and Linda Preziosa, she's able to look with the ultrasound transponder, and she looks in, and she's able to insert the needle right where it goes. And believe it or not, I asked the patients how did it feel after the injection, and they go, it's no big deal. A little sting, but no big deal. And that's typically what happens. And then that cellular tissue gets to work, and we do rehab with it. And we do chiropractic care with it. And you're like, why would you need to do that? Well, number one, research tells us that if we teach you how to recalibrate your body by moving properly, by stretching your muscles. See, the things that cause the problem are your muscular structure, your tendinous structure, your ligamentous structure. If they have not been rehabbed, they're going to cause the same problem again. You understand what I'm saying? If we leave the structure the way it was after the injection, the way it was before the injection, and we leave it afterwards, it's going to cause the same problem.
Right.
Make sense? And so we changed the dynamic of the joint itself, whether it's the knee, which is the most popular, the hip, the shoulders, the elbows, the low back, whatever the joint is. And that's what chiropractic's for as well, because chiropractic stimulates the nervous system to talk to each other. And it is the immune system. It's the signaling system for the immune system. So these signaling cells go inside you, and if there's any interruption in the nervous system, then the communication is not that good. Well, we get you adjusted, and now the communication improves significantly and dramatically. And what's really cool is that the recalibration we're trying to do with all the movement, the PT work, the rehab work, next thing you know, guess what happens? You start healing faster and better than without it. It's as simple as that.
Well, Tim, if somebody is a candidate for this or feels like they want to be a candidate for this, how do they get in touch with you?
Well, it's very simple. It's the phone number is just simple put. It's 252-210-3490. I'll say that again.
Say it again.
252-210-3490. Okay? And then you can also go to horizonmedical.us. It's Horizon, not with a V, but with an H, horizonmedical.us. Or you can find us on Facebook, Horizon Medical.
Right. Okay, and we'll be talking more about this as the month goes on with New Year, New You. We'll have, you're going to be on Linda's show next Wednesday, so you might want to listen up. That's a whole hour of talking about this, understanding this, so we'll remind you of that throughout the week, next week, and you'll be on then, and then hopefully we'll have Dr. Graber when she comes to talk about it along with you, to talk about it more. So we'll get this introduction going and hopefully make you understand this process. But anyway, if you are interested, if you've got knee issues, hip issues, and you just don't know what to do, because, you know, knee surgery is not and hip surgery, either one. They're not the easiest thing in the world. Now, let me tell you, it's not a cakewalk.
One of the hardest parts is the rehab.
Yeah, it's not a cakewalk. So anyway, if this is something you're interested in, please call. There's the number on the screen. So please give them a call and hook up with Dr. Treanor and his staff, Linda Prezioso, and let's get you going back to the new you that we want you to be. We want everybody to be. So thank you, Tim.
Thank you so much.
Absolutely. And we'll be right back with you right after this.